This is our patient Luna, and Luna's here today to get spayed, and we're going to, she's also in heat, so you're going to get to see that as well. And so now what we're doing is flushing her IV catheter that we've already put in this morning, and then we're going to give her medicine to make her sleepy. So this is kind of her pre-anesthetic induction medicine. She's such a sweet girl. And so when you come to Agape, you know, we take the precautions that you would if you went into the human hospital. That's what we're doing here. And so we're going to give her some more medicine to make her sleepy, and we're going to put a tube in her, just like they put tubes in people. And this stuff that we're giving right now is human grade IV anesthesia. So it's the expensive stuff that they use in the human hospitals. It's the same stuff we use here. And it really it's really nice because it makes them kind of go down like they're in a dream state. And then when they wake up, they also wake up the same way, kind of from a dream state.
Let me see, the other one had a microchip too.
Let's see, are we ready? Got trouble tongue? Still got a little bit, but I think it's pretty good. I can.
Okay.
Yeah. Let me get the tongue. You got it? Okay. So we call this procedure where we stick the tube in intubation, and then we'll tie the tube in, make sure it doesn't slip out, and then we inflate what's called the cuff, which is a little thing around the tube that completely fills the windpipe. And the reason for that is if she were to vomit under anesthesia, we don't want that, because she can't swallow, we don't want that to go down her windpipe and into her lungs, which could be fatal. So that's the reason for the tube. Tube's very important. Not every veterinary practice always tubes. I've been at some that didn't, and it's not as safe, and so it makes things more dangerous for the patient, and so we don't want that danger, so we take the precautions of putting the tube in. Okay, ready to shave?
Yeah,
Or you want to check?
Yeah, we'll check.
So we're going to check now to make sure the tube is not leaking any air, because we want to make sure that that doesn't happen, or that scenario I was just telling you
Before you
about.
flip her, I'm going to go ahead and give her her microchip.
Okay.
while she's out.
So she's getting a microchip, which is a pretty big needle. And Kendra, if you'll show the camera the size of the needle, which is why we recommend doing it under anesthesia. It's a very large needle. Okay, and then we'll shave her for the surgery.
Do you want the front?
Yes, please, yeah, you'll hook that up. And so the other thing we do for every spay and every neuter here at Agape is we monitor on these machines. We monitor different parameters. So we're about to hook up the blood pressure cuff to her and make sure we get her blood pressure, which is one of the most important anesthetic parameters to monitor. And we're also monitoring oxygen percentage in the blood. We're monitoring ECG leads. And when we get her into this is our prep room, but when we get her into our operating room, we'll hook all of it up into a different machine. And she's getting, through the tube, she's getting oxygen and she's getting gas anesthesia. And so we're maintaining both of those things with this machine. And then she's blowing off carbon dioxide, which is going into a filtration system on the purple canister at the bottom there, which we change routinely. So we're in surgery now in the OR, and so we have a big oxygen tank that we're regulating. We also have this little heat pump here, and that's to warm the patient. So underneath here we have a warming blanket that keeps our patients warm. So we're trying to keep their body temperature as normal as possible. We also have, I'll pick it up for everybody. We have our laser therapy here. So once surgery's done, we will laser the incision, and that helps with pain after surgery. So that's what we do afterwards. We have our monitoring equipment over here. That's Kendra and Missy are hooking up now. And we're looking at lots of things. Like I was telling you before, it's ECG leads, so we're looking at electrical conduction through the heart. We're looking at the amount of oxygen in the bloodstream. We're looking at temperature. We have a temperature gauge on this one. We have end-tidal CO2, which is where they're blowing out CO2. And we have blood pressure as well. So all of those are very important things. You know, and most people don't think about what goes into a spay at Agape, but at Agape, you know, we're spending thousands of dollars on the equipment to make sure that your pet has the safest experience that they can have. And so, so that's really what we wanted to provide here, is the human grade quality that you would want for yourself, and that's what we do for your pet. And so we're monitoring with, or we're using the same anesthesia that we used before, the gas anesthesia, and Luna is getting all of that, and she's got a nice plane of anesthesia. Her blood pressure is perfect. Her heart rate slightly high, but the medicine that we gave makes the heart rate a little bit high. And Missy's even trimming her nails now while she's under anesthesia to give her a good pedicure. So we do full service here. Everything that you would want for your pet done, that's what we try to do. And so Dr. Estes is going to be doing the surgery. So she's getting washed up. She washes her hands and gets in a gown. And so Dr. Estes is here. And she'll be our surgeon today for Luna. So one thing that a lot of people don't know either is that when we get in and we start cutting and we start using suture material to ligate blood vessels, we're actually opening an individual pack. These packs are not cheap. They're very expensive per pack, but these are sterilized. And so that's what we do for each patient, is a new pack of suture. And so again, you know, I've worked at places that didn't always use new packs of sutures. They would put packs of suture in cold water and use it for an internal surgery. We do not do that here because we want to make sure it's sterile and that it's new and that it's fresh. And so that's what we do for every patient. So here we're in the middle of the spay, and so we're Dr. Estes is showing you the ovaries here at the end near the suture, the steel, stainless steel. Those are ovaries and ovaries. Those two obviously, and then you can't see the fallopian tubes, but they're real small in the tissue. And then we got the uterine horns, which in dogs and cats are very big because they have litters. And then at the end of the uterine horns, where they come together, is the body of the uterus, which is kind of small in a dog but bigger in a woman. So there's a difference between people and dogs and cats. And Dr. Estes is just about to ligate the body of the uterus as it comes close to the cervix, and she'll catch it right before it hits the cervix there. But this is how we spay. So we're closing up. Luna's done great. Her blood pressure is good, oxygen's good, heart rate's good. And Dr. S is just about to finish, so she's putting in the first layer. So we do a 2 to 3 layer closure depending on the doctor. So we're actually stitching not once, but at least twice, maybe 3 times. And so this is what's called a simple interrupted stitch, or are you doing a cruciate stitch, Dr. Estes?
I'm doing cruciate.
Cruciate stitch. And so she's doing that on the muscle layer. That's really the holding layer to keep everything, the intestines and everything inside the body. And then she'll come back and do another stitch after that, which I assume is subcuticular is what you're going to do next.
Yep.
And then she'll do a final subcuticular stitch, which should get the skin and the tissue underneath. Then we'll do our laser therapy, and then after that we're going to give a pain injection shot that'll last almost the whole day. And so the combination of all those things prevents a lot of pain in the patient. Anytime that we have a dog in heat like Luna was, there's a little bit more bleeding with the surgery than we normally see, which is why there's an extra charge. We use more suture, there's more bleeding. It takes a little bit longer. Usually Dr. Estes is in and out of surgery pretty quickly, but just go a little slower and make sure she gets everything done properly and all the blood vessels ligated, even more ligatures around them so that we don't have any bleeding. And so she's finishing up here, but Luna's doing great, and we've got another successful spay. And so now Kendra's given the pain injection shot that helped with Luna's pain after surgery, and is about to do laser therapy, which is going to heat the tissues and cause the tissues to go through their cell cycle. It'll cause blood flow to be increased even more, and it also kind of disinfects the incision. So if any bacteria is hanging out, it's going to kill that bacteria. So we're here with Luna in recovery, and she's still got her tube in, and so we're going to let her kind of wake up slowly, and once she starts swallowing 3 times roughly, we will pull her tube out, and then she'll be recovering without the tube. One thing we also do, even once the tube is out, is we watch for any kind of signs of wanting to vomit, and that's why we have them in this recovery area where we have easy access to watching them. And so if she were to vomit, then our nurse, Kendra, would come over and put her head downhill and allow her to vomit where gravity pulls it down and not back into her lungs. So we still are very cautious about our patients even after they wake up, and we have our eyes on them at all times. So the recovery process is just as important as the surgery process in making sure that this patient is taken care of.